Avian influenza, commonly known as bird flu, is caused by the H5N1 virus. This virus primarily affects birds. However, it can sometimes jump from birds to humans. H5N1 infection in humans is a serious concern. The virus has a high mortality rate in confirmed cases. This means that a large percentage of people who get sick with H5N1 die from the disease. Currently, H5N1 does not spread easily from person to person. Most human cases are linked to close contact with infected birds. This limited human-to-human transmission has prevented widespread outbreaks. However, the virus is constantly evolving. There is always a risk that it could mutate and become more easily transmissible among humans. The World Health Organization and other health agencies closely monitor H5N1. They track the virus's spread in birds and monitor for cases in humans. Early detection of human cases is crucial for containing potential outbreaks. While H5N1 poses a significant threat, it's important to remember that a pandemic is not inevitable. Imagine a scenario where H5N1 acquires the ability to spread as easily as COVID-19. This hypothetical situation is a nightmare scenario for global health. COVID-19 spread rapidly across the globe, infecting a large portion of the population. If H5N1 were to become similarly contagious, it could lead to a devastating pandemic. The combination of high contagiousness and high mortality rate could overwhelm healthcare systems worldwide. Hospitals and healthcare workers would struggle to cope with the influx of critically ill patients. The demand for ventilators, hospital beds, and medical supplies would far exceed the available resources. Furthermore, the economic and social consequences of such a pandemic would be profound. Lockdowns, travel restrictions, and business closures would disrupt daily life. The pandemic would have a devastating impact on global trade, tourism, and overall economic activity. While concerning, it's important to note that a virus maintaining a 60% mortality rate while becoming highly transmissible is unlikely. Viruses evolve to survive and spread. A virus that kills its host quickly is less likely to spread widely. This is because the host may die before transmitting the virus to others. Therefore, if H5N1 were to become more contagious, it's probable that its mortality rate would decrease. This is because milder cases, which are less likely to be fatal, contribute more to virus transmission. However, even a lower mortality rate combined with high contagiousness could still result in a significant number of deaths. For instance, if we assume that H5N1 becomes as contagious as COVID-19 and infects 20 to 30% of the global population, that would be approximately 1.6 to 2.4 billion people. Even if the mortality rate were to drop to 10%, the death toll would still be a staggering 160 to 240 million people. Despite the potential for devastation, we are not powerless against H5N1. Vaccines and antiviral treatments can mitigate fatalities. Rapid vaccine deployment is crucial in containing the virus. Antiviral drugs like oseltamivir help reduce viral replication. Access to these medications is limited globally. Public health measures like surveillance and contact tracing are vital. The threat of H5N1 reminds us of the constant danger of infectious diseases. Continuous monitoring, research, and global health security are essential.